The recent attacks in Brooklyn and the hostage-taking in Sydney seem to have a common thread: heinous acts by people with a history of mental illness. But is that what's behind these attacks, or was it hatred of police in Brooklyn and Islamic extremism in Australia? Let's ask Dr. Michael Welner. He's a leading forensic psychiatrist. He's also the architect of something called the depravity standard, which uses public opinion surveys to help courts define the very worst of crimes. Doctor, thanks so much for being here.
Good morning. Nice to be here.
Let's start with Brooklyn. The gunman behind this said he was retaliating for the Michael Brown and Eric Garner cases, but maybe he was just mentally ill. How do we know which one it is?
For people who haven't had an opportunity to review records, even professionals and who have access to files, that can be a very difficult distinction to make, because sometimes people are driven by criminal deviance, sometimes they're influenced by psychiatric illness, and sometimes it's a bit of both. I think that what's most remarkable about the Brooklyn gunman is that while you see many, many, many arrests and a history of violence and even an experience where his family was frightened of him, by the time one goes through the system that many times, you're definitely going to see a psychiatrist. And if you don't have, with that colorful history, an experience of significant hospitalization, well, then you have a lot of psychiatrists who are concluding that you have antisocial personality or you have drug problems, but not the kind of psychotic drive that we speak of when we find an irrational crime.
Okay, so you're drawing a distinction. I just want to make sure, between antisocial behavior or substance abuse and mental illness. There are two different things. He might have had the first, but not the second.
Yes, and from a standpoint of us as a public looking at it, there are crimes in which a person is playing to his own idea, an irrational idea that nobody shares, and there's a crime like Brooklyn and like Sydney where someone plays to a constituency that thinks exactly as he does, whether we choose to admit it or not. He was from Maryland. He didn't carry out his crime in Maryland. He came to New York. He didn't carry out his crime as soon as he came to New York. He went to an area where there is established tension between the police department and local residents and said, watch what I'm going to do. He was using social media to brag about what he was going to do. And then after he did it, there were some local residents who were clapping and laughing in the aftermath. And the parallel between that and a Sydney offender is, this is not a person who was isolated as the government would suggest. He had 14,000 followers on Facebook. So he had a constituency. He was a peace activist. There are some peace activists who experience an entitlement to violence.
Meaning he claims he was.
Well, you know, there are some folks who work in different causes, and they may call it social justice. Somebody may work for Greenpeace and feel entitled to blow up a ship. It's violent, but they call themselves an activist with the idea of social justice in mind. He may have had an advocacy, but he chose violence as a way to express himself, and there are others who identify with that. Mental illness and a mental illness-driven crime has a quality of irrationality to it in a way irrationality to it in a way that nobody could relate to it except the perpetrator himself, because he's playing to himself and his own needs and his own demons in his head.
Here is what the gunman in Brooklyn's sister had to say about his past. She believes that he was mentally ill. Let's listen to her.
This has nothing to do with police retaliation. This was a troubled, emotionally troubled kid. He needed help. He didn't get it.
She says he needed help. He didn't get it. He did go see various psychiatrists. He testified to that when he was arrested the 19 times. Is there a way for families to commit people to mental hospitals or to get them the help they need, even if they themselves won't do it?
We absolutely have solutions available to us right now in the United States to enhance the ability of families to deal with people who are in crisis, whether that crisis is precipitated by drug abuse or acute reactions to, in his case, rejection by a girlfriend.
So then why couldn't they have gotten him
Well,
help?
there's solutions that are available, but they are laws that need to be passed. We've talked on this program before about Congressman Tim Murphy's resolution, H.R. 3717, helping families in mental health crisis. What we don't yet have are families who are empowered to say, my loved one is going down the drain. My loved one needs acute help. A person who doesn't want help and who has no insight can go into an emergency room, pull it together, say, I'm not going to harm anybody, I'm going to be fine. And we had a familicide last week in which somebody wiped out 6 people in his family, then killed himself, and his wife was clamoring that she was terrified of him and that he was going down the drain. So there's legislation available. I would encourage your viewers to call their congressman and to support 3717, because families are cut out of the decision-making process about getting help. Now, I would also quickly say that we don't know what happened in his mental health background. I would expect a family member to distance themselves from hatred and in such a way that it doesn't reflect on the family. So I understand her position, and I think the evidence ultimately speaks for itself.
Very quickly, one of the things you touched on, and I think this is really fascinating, he first shot his ex-girlfriend. And you say that often one of the distinctions between mental illness and a rational player is that it comes after romantic rejection. Then people do these spectacular crimes to prove themselves. Both of these crimes involve spectacles, but spectacle homicide, in my experience, and I've worked on a variety of these cases, spectacle homicide is seen in people who have high expectations of themselves. And he talked about wanting to do something good. But the trigger for them is the finality of an important romantic rejection or social sexual alienation. The idea of doing something that's so spectacular. Why? Because they identify their masculinity through their capacity to destroy. All of us who speak publicly, we can shape a message that say, you're not a man by virtue of whom you can destroy. And when people who are seduced by ISIS get pulled into this, are exposed to a message that says, your manhood is not defined by your ability to destroy for the sake of destroying. We create a force to counter that. Right now, there's tremendous pressure on the entitlement to violence toward police officers, and we can send a message out that that doesn't make you a man to kill for the sake of killing. Let's hope we're doing that this morning. Dr. Michael Welner, thanks so much for being on New Day. Let's go over to Chris.